Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir, here from the JWC studio, and today we have a very different episode. Now, if you've been watching Wellness Day for the last year, you would know that we've been talking about everything about wellness and how to stay well. Don't just get well, stay well on the preventive side. But sometimes life happens that's out of our control. Accidents and emergencies happen. And that's why I'm talking to the head of our emergency department from Jahangir Hospital, Dr. Soumya Chandrasekhar. Thank you so much for being here, Dr. Soumya.
Thank you for inviting me on your podcast, and it's my pleasure to be here.
Absolutely. So, yeah, as I said, this is a slightly different episode to the most topics that we talk about. We always talk about preventive, how to stay well, and which is obviously what we want to encourage for everyone. But as I said, sometimes life happens, accidents, emergencies are unavoidable. Yes. So you're probably at the most stressful and potentially, that end of what we would see in the hospital. So I'll just start with you in terms of what you do for your wellness. What does wellness mean to you?
Wellness, I think, as it is for everyone, we should be getting our wellness checks done every year. And apart from that, for myself, I do my yoga regularly.
Yeah.
Apart from that, no sugar days.
Okay.
There's no sugar days because I think cutting sugar helps a lot.
Which is your no sugar
So
days?
my no sugar day is Monday usually.
Okay.
So at least once a week, I make sure that I don't take sugar of any sort,
Right,
red or
right.
reduce on the carbs. But the rest of the days are fine. So
Okay.
you can't do that every day.
Exactly. But then coming then to the head of what you do at the hospital emergency and or rather accident and emergency. Now, as I said, probably one of the most stressful places you can be in a hospital. Firstly, what are the most common things that you see coming through your doors?
So it can be as simple as, patient coming in with fever, cold cough, gastrointestinal illnesses like vomiting and diarrhea.
Yeah.
And something as severe as a patient coming in with a heart attack or a stroke or a trauma because of a road traffic accident.
Yeah.
So it can range from anything as simple as that to something very acute and something that needs urgent care.
Right.
Yeah.
But have you been seeing any trends of any particular area that's increasing? Like, for example, are you seeing more heart attacks? You see in the news every now and then that, younger people are getting more heart attacks.
Yeah.
Are you seeing more heart attacks, more strokes?
So especially during this time of the year, we see a lot of heart attacks and a lot of strokes also. And what we've noticed is that it's started to happen in a much younger age group
I see.
than before. So we see a lot of patients in their 30s and 40s who come in with chest pain. And
Wow.
we get an ECG done and it's an MI or a heart attack.
Right. But why do you think that's happening? In any sense?
Again, what we can attribute it is to stress levels, your diet, lifestyle.
Yeah.
Yeah, so all of that. Because we see people who were smoking earlier, not taking care of their health, sedentary lifestyle. all
Right.
of that.
Yeah. Well, taking a step back then, maybe even before people come through your doors, the accident or the emergency happens usually at home.
Yes.
What are the sort of biggest advice that you could give people to what are the warning signs that people should be looking out for for example, for a stroke or for a heart attack in particular? Because those are things that you can see at home.
Yeah. First of all, go for your preventive health check so you know that, you're not vulnerable
Or at high risk.
or high risk for these conditions. But then again, if it does happen, I think people around you and, the person himself or herself should be aware of a few symptoms. You feel discomfort of any kind in your chest, back, anything radiating to your jaw, neck, sweating, unusual pain. You exercise or there's some exertional activity and then you notice that you have chest pain or shortness of breath. Anything unusual, you should get it checked.
Okay.
Don't ignore your symptoms because we've had patients with very, very unusual symptoms. They feel they just have a lot of acid reflux and then it turns out to be a myocardial infarction or a heart attack.
Okay.
So any symptom shouldn't be ignored. If you think it's anything unusual for you, you should get it checked.
Yeah, that's a really good point, because sometimes people can think that I know this might be silly. I don't need to go to the emergency for that, and I might look like a fool.
Yeah, that's something a lot of people are worried about, but there's no harm in just getting it checked.
Yeah,
To
better
make-
safe than sorry.
Yeah, exactly.
Yeah.
So yeah, that would be it for heart attacks. For strokes, I think there's a lot of awareness that needs to be there, because a lot of people are not aware about stroke. Stroke it's actually a brain attack,
Yeah.
similar to a heart attack. And what happens here is that obviously the patient is not in much distress in terms of pain, but to be able to identify that it's a stroke, people should be aware of it. For example, one-sided weakness, a limb weakness of the arm, of the leg,
Yeah,
not being
yeah.
able to speak properly. So we have a mnemonic that everyone can remember very easily. It's called FAST. So facial droop, arm weakness,
Okay.
slurring of speech,
Yeah.
and at what time all of this started. So FAST is something you can remember. Anyone can,
okay.
yeah. So if you remember this, you know that if there's any of this, you need to get in touch with either an emergency medical service, or you need to get yourself to a hospital.
Okay.
Because the time of onset of these symptoms matters.
Right.
Because the faster you get to an emergency, the faster we can do a scan and start our treatment.
Of course, that golden period, what they say for the stroke.
Yeah. The
What about things like skills that people should have, like CPR, those kind of things? How does one do that? Is that something that people should be aware of?
Correct, yeah. So what everyone should do, this is what is taught in a lot of schools abroad. And I think people are gaining awareness here in India as well. So you should equip yourself with basic life support skills. So that would include learning how to do CPR. So we
Yeah.
have a lot of courses that teach you this.
Right.
There are a lot of videos online, but I would suggest that you get hands-on training so you know how to do it. We have mannequins, yeah.
Yeah.
So when you learn how to do this, because it's as simple as, being able to identify that the patient is not responding to you, doesn't have a carotid pulse, which is the pulse in the
Right,
neck.
yeah.
And when these two things are not there, they're not responding to you, there is no pulse, then you know that you need to call for help. Okay, so make sure that you have your ambulance numbers with you so that you know who to contact in an emergency.
Yeah.
Then you know your basic skills of starting how to give, starting to give CPR, which is chest compressions. So something as basic as chest compression started early can actually help to save the patient. Because a lot of times we get patients who are brought to the hospital after about half an hour, and that half an hour of unresponsiveness and no CPR, it's very difficult for us to revive the patient after that, because there's already that phase of, about period of about half an hour when the patient's not received CPR. So there's
Yeah.
no blood supply to your brain. And when that happens,
Right.
there's already that neurological damage that's set in.
So you're saying even if you're not an expert, even by doing just a little bit of CPR or whatever it is that you can do, if you have some basic understanding, it can make a huge, huge difference, is what you're saying.
It definitely can.
Yeah.
And these courses are just, a one-day course. These days you have a lot of heart saver courses where you can do a part of the course online, and you can go in and just do your skills on the mannequins,
Okay.
the hands-on training. So that takes you just about half a day to complete. So I think everyone should equip themselves with these skills, because these are really life-saving skills.
Great takeaway that
Yeah.
people should really be doing CPR. And it's what you said. It's one thing to see the video, but then it's another thing to actually test it or try it.
Yes.
Because actually it can be quite strenuous.
Yes.
It's good
It can.
exercise. Or not good exercise, but it's exercise.
Correct, yeah. What you say is really correct, because when you start giving CPR, after about 2 minutes, you begin to notice that you start to get fatigued. And this is something that we see even in the hospital, which
Yeah.
is why we switch compressors every 2 minutes, because the person who's giving CPR tires out.
Yeah.
So only when you actually practice it on a mannequin do you realize the depth and the rate at which you should give the compressions. But it's not something very hard. So I think, even children can learn how to do it,
Yeah.
because it's a basic life skill, and they can help to save someone around them if,
Right.
if such an event happens.
And so powerful to do. Or rather, how important it can be.
Correct, yeah.
Another then related sort of question from your experience, if one had to just make a first aid kit and keep it at home, what would be the biggest things that you would advise people to put in that kit?
Yes. So first aid kit, you should have your basic, cotton gauze and your dressing material, including, betadine, band-aids. You can keep a thermometer, a flashlight, all of this in your basic kit. The rest of it, any emergency ambulance service should be able to take care of. But another thing that I would advise, that most people in there, now a few societies, public places have AEDs.
Yeah, I was going to ask about that. Those big red boxes that have AED written on it. Right?
Yes,
Yeah.
yes.
So what is that for someone who doesn't know?
Yeah. So an AED is an automated external defibrillator. So actually, these are now found in airports, railway stations, in malls. So one should equip themselves to be able to use this AED. Okay, so again, I'm back to mnemonics again.
Yeah.
So here we have a mnemonic which is PASS. Okay, so this you can learn how to do, of course, with one of those courses on basic life support. The PASS says P is for power on or switch on the AED.
Okay.
And then you have these leads that you can attach onto the patient's chest. So A is for attach. Then the device analyzes the rhythm. Okay, the
I
heart
see.
rhythm.
Actually analyzes the rhythm. Okay.
Yes. So the device analyzes the heart rhythm and tells you if a shock should be delivered or not. So if it says deliver shock, so it gives you prompts. So if it says deliver shock, then you see a light that starts blinking and you need to make sure that no one's touching the patient and then press the button that's blinking, which is the shock button.
Okay.
So it's just PAAS, power on, attach the leads. The device analyzes the rhythm and tells you if you should shock the patient or not.
Right.
So it's as simple as that. It can sound scary that you are
Shocking someone.
shocking someone, exactly, but the device is a very safe device to use. So like I told you, even children can use it if they learn basic life support. So all you have to do is, if you have that device, attach it onto the patient. If it gives you those prompts, just
Right.
follow the prompts.
Interesting. I didn't know the step that it actually tells you whether it needs it or not. That's an interesting one. I thought it's just something that it's like a button that you press anyway.
Yeah. So even if you don't have to deliver a shock, it says do not deliver shock.
Exactly.
Yeah.
Exactly.
So you know that you don't have to do that, and you just continue giving your chest
Right.
compression.
And this is something. Oh, I was just going to ask you that. Is this something that you do instead of CPR, or is it something that is like a added plus?
Yeah. So you do it along with CPR.
I see.
So the most important thing is CPR or chest compressions. That is when we actually assess that someone is unresponsive, does not have a carotid pulse, which we check in the neck. So that pulse needs to be checked at least for a period of about 10 seconds.
Right.
So if you see that someone doesn't have a central pulse and is not breathing, call for help and immediately start with the chest compressions.
Okay.
So once you start in the chest compression, so you've called for help, so that help should bring in this AED.
Okay.
So when the AED comes in, it has to be attached as soon as it is in in that place. So once the AED is attached, then you keep your hands off of the patient and follow the prompts. Once it says deliver shock, deliver the shock. If it says shock not to be delivered, you continue with your chest compressions.
Okay.
And once shock is delivered, also you need to resume chest compression.
Okay. Interesting. There are lots of places
Yeah.
of where we can talk about. Maybe we can switch a little bit and talk about perhaps, during the festive season. I don't know whether you see a lot of this, but you get a lot of people who've had maybe too much to drink stumbling into the ER or getting dragged into the ER.
Yeah. Many times dragged into the ER even if they don't want to be there. So that's something we do see at the end of the year,
Yeah.
especially New Year's Eve.
Right.
And so a lot of times it is just about, getting over that phase.
Period.
Yeah, getting over the period where we just hydrate them with IV fluids and, the vitamins that they're deficient in, like thiamine.
Right.
So, and usually they get okay with that. But some of them do require admission and further care.
But actually, jokes aside, probably the one aspect that perhaps people think about when this kind of thing happens is that, the thing that you see in movies about people choking on their vomit or something like that, if they've passed out or that kind of thing. Is that something that you all address when something like this happens? And if there's any advice for people? Of course, we're not advocating for people to be in that state, but if they are and have to
Correct.
deal with someone like that.
So if they they reach that stage of they're very drowsy, they're sedated and they vomit, there is a risk that some of these vomiters can go into the lungs, something that we call aspiration.
Yeah.
But then if they're not so drowsy and you mean, actually choking on a foreign object, like, something that's a solid, then that's also part of your basic life support, where there are these maneuvers which, are back thrusts and abdominal thrusts.
Yeah, that's
So
another
we
good one
give-
that people should actually be aware of. Yeah.
Yeah. So this is also something that you learn in the basic life support courses. So, there are back thrusts that are given, about 5 back thrusts, and then abdominal thrusts. So when you do this
from the front.
from the front, so you encircle your hands around the patient and then you give abdominal thrusts, which helps to bring out any foreign object if there is anything.
Yeah.
the other thing is, if someone is able to cough, you encourage that cough.
Okay.
So you encourage them to cough because they can bring it out themselves. But if it's a weak cough and they're not able to cough it out, then we give them these
Then
common
I suppose then the air is blocked or whatever it is.
So it's blocking the airway. So that's when we give the back blows and the chest thrusts.
Really insightful and important points that you're giving us today, Rak. Any points that you think that we haven't covered yet that are important from this standpoint that people should be aware of?
Yeah. The other thing is, look, emergencies are something that, come out of the blue. We don't expect it. But what we can do to be prepared is, first of all, equip yourselves with, one of these basic life support courses. And apart from that, keep yourself emergency ready. That is, if you have any insurances, you have your, ID cards, keep all of this handy, a soft copy or a hard copy.
Yeah.
Your latest prescriptions, your wellness checks.
Yeah. Prescriptions.
Because prescriptions, because a lot of times, and keep your family aware of where you've kept it, or give them access to it.
Absolutely.
Because what we see is when people end up coming to the emergency department, there's a lot of times when we don't have all that data.
Yeah.
We don't know what medicines they're on, what health conditions they have already. Or, that's the time when they start, looking for if they have an insurance, what their
Yeah, absolutely.
registration numbers are and all of that. So it'll help them save time if they keep all of this ready.
And that's such a good point that you make, and this is something that needs no expertise, no training, no online videos, no courses.
Exactly.
Just as you said, being this prepared or emergency preparedness. That's a lovely takeaway, actually.
If you have your family members, you could probably make a WhatsApp group of all of them and share all of these details so they know in case of an emergency that these are your, documents that you need to have in an emergency.
And because when you're on that state of mind or panic, you don't be dealing with this kind of stuff.
Exactly.
That should be right there, as you say. So what do you do for your stress, doctors? I mean, as I said, you're in a high stressful environment all the time. And you said that you do yoga and things like that. But what is it that you focus on for your mental well-being?
So back home, don't think about what's happened.
Yeah.
I mean, it's easy to say because you do get calls from the hospital and all that. But then again, these things, breathing techniques, pranayam and yoga, that helps me a lot. And of course, I used to play squash, which I don't anymore.
Okay.
Then read books and all of that. So,
Okay.
yeah, that's about it.
Well, any final thoughts that you like to leave us with? I think you've left us with many things to think about and be prepared about.
Cute.
So,
I think that's about it. Just be emergency prepared. Most of the times you don't know what exactly you have to expect, but these few things that you
as
can
much as
do,
you can do.
Yeah.
Absolutely.
Keep your documents ready. Do a basic life support course.
Right.
Keep yourself aware about these health conditions like a heart attack, a stroke, and and hope for the best.
Absolutely. And that's what we hope for as well.
Yeah.
Well, thank you so much for being here, Doc. It's been an absolute pleasure, honor having you here. You are absolutely, truly a lifesaver. So thank you for everything that you do and continue to do.
Thank you. Thank you for inviting me on your podcast. and
Absolutely.
It was a pleasure talking to you.
Thank you. Thanks, Doc.
Thank you.
Thank you all, and join us next week. But before you leave, do not forget to hit the like and subscribe button here at the bottom. Any comments that you may have, feedback, topics that you like us to cover, please do not hesitate to write here in the bottom as well. We will make sure that we will be listening and hearing everything you say. Thank you, and see you next week.